Medical Dilemma.
Hi everyone, you're still tuned in on Medical Dilemma right here on GNN. I'm Attorney Sarah Jane Sugitan, and joining us is another OBGYN, Dr. Attorney Teresita R. Sanchez is also my co-host. Welcome to the show, Dr. Sanchez.
Hello.
And you're also OBGYN, right?
Yeah,
So I'm
yes.
sure you already understand what we're talking about. But kanina nga sabi ko kay Doc, concern ko. You know, Doc, when I was younger, during grade school sex ed class, I think it was discussed to us that at the onset of menstruation, pain during menstruation is totally normal. But
Yes.
it is, I mean, but if you feel it, I mean, you feel the pain or discomfort or cramps, isa lang po ba yun? Like yung cramps, yung mga sinasabi nila, 1 week na hindi makalakad, ganun kapag may mens, is that something to watch out for? Although we've already discussed the symptoms, Dr. Madrilejo, or...
Well, for me, if 1 week you cannot move for 1 week, then that's something serious.
Oh, yes. Oh.
And if there's pain during your menstruation, I feel there was a study, international study, that it takes 6 to 7 years before endometriosis can really be diagnosed. Like, it's a welcome sign. I have my menstruation, I have pain. That's okay. Then suddenly you try to notice that it's getting worse and everything, more bleeding. Then what happens? You go to a doctor because you're not getting pregnant. So how many years already? 4, 5, 6 years. So it takes 6 years and the doctor now will discover it. So it would be best that every woman should see their OBGYN or their tertiary primary doctor to tell the doctor that, hey, look, I can feel something heavy, I have constipation, I have frequent urination, I have dysmenorrhea. Then the primary doctor should refer or take care of the patient.
You know,
Yes, Dr.
Sarah,
Sanchez.
see, Dr. Madrilejo is really an expert in endometriosis. So, you know, in our specialty, you can be like a general practitioner in OB, right? But then now, some, like our guest before, Dr. Eileen Manalo, concentrated on fertility, right? And then, but Dr. Albert
Subspecialty
is
po
this
kaya.
endometriosis. All the details, all the literature abroad and here, master na niya yun.
No.
Yeah.
Okay, Dr. Madrilejo, let's go now to the treatment. So once a patient is diagnosed with endometriosis, ano po ba yan? Ino-operahan ba yan? Can it be cured by antibiotics or what's the treatment?
Okay. The treatment of endometriosis is individualized.
So
There's no hard and fast rules.
Correct.
Every aspect, every patient, every environment, what condition, future plans, single, married, you belong to the what you call it, religious group, then it has to be individualized. You mentioned medical or surgical. Well, if a patient is not married, if a patient is single, if a patient is young, most doctors would give just painkiller and observe the progress of the disease. It could range from paracetamol to mefenamic until it becomes more severe, and then that's the time you issue more aggressive treatment. Medical. Still, if it's medical, you can go to, so the first step would be painkillers.
painkillers.
Single, college student, belongs to a religious order. But then, if that cannot be, that cannot control the pain of the patient, then you go to contraceptive pills. Doc, contraceptive pills? Yes. Why? What happens? When you have contraceptive pills, when you give it to a patient, the effect of it is the lining of the uterus or the endometrium, and so are the islands of endometriosis outside are a little bit thinner. So when you bleed or when menses come, less pain, isn't it? Why? Less irritation, less adhesions, less scar tissue. So contraception helps. At the same time, some would give it continuously. I don't think we have to mention, there are side effects like spotting, but they would give it every day in the hope that there won't be any menses. When you give it every day, no menstruation, no dysmenorrhea, no proliferation, no
No
dissemination
cramps
of these islands of
tissues.
endometriosis in the pelvic organs.
As a matter of fact, Albert, diba, we advise people who have some sort of the endometriosis, whether it's mild, to get pregnant right away, right?
Yes.
Because it can help.
It,
Can address
the best is, that's the third treatment medically. Progesterone or get pregnant.
Get pregnant.
You have to get
Because
pregnant.
in pregnancy, you have a lot of progesterone there in your body.
The effect of pregnancy or progesterone would decidualize the endometrial lining all over your body
Pero
in the pelvic
yeah.
cavity.
But as you mentioned, Doc, it can also, endometriosis can also lead to infertility. So if you're, although you're single and trying, but you're trying to get pregnant, you have sexual intercourse with your
The
partner.
advice is to get pregnant
Okay.
if you get pregnant. But it would be hard to get pregnant.
We don't know really the cause, no? Why
Yeah.
the female is infertile because of this.
Well,
what could be the
there
possible
would be
explanation?
several causes. They say that if there's endometriosis, there would be an increase in circulating white blood cells on the peritoneal cavity of the woman. So sperms, finds its way inside the uterus and sperms are immobilized. That's one. Number two,
If they don't meet, certainly no
Number-
pregnancy, right?
yes, doctora, and then the development of the egg will not be that nice if there's endometriosis. So again, poor quality of the egg, poor development, there would be infertility. The third would be somehow because of autoimmune or immunological reason, we find it every day. Patients with endometriosis, there's a high incidence, doctor, of immunology. The sperm and egg does not meet. Or they cannot unite. And if they do unite, we find that the miscarriage rate is high.
Hi.
And sometimes something happens to the embryo just because of endometriosis. You talk about in vitro fertilization, way back 1992 in Singapore, they have several papers that implantation or success of IVF is a little bit lower compared to the group without any endometriosis.
But there's still a possibility, although as you said, it becomes difficult for a female afflicted with endometriosis to get pregnant.
Difficult and expensive.
Expensive. And Dr. Albert, even if they're successful now and they have a baby, no abnormalities, right?
No, there's not. There's not.
Normal babies.
So the baby will still be normal.
Yes.
But the treatment, doctor, how about surgery? Is this an option?
Okay, so still if it's young or what, the main point here is you don't want menstruation. If there's menstruation, there would be proliferation, there would be scattering, dissemination of these island tissues of endometriosis. Now you can give gonadotropin releasing hormone agonists. This would, if you inject it to the patient, I use the 3 months depot. It's a trade name, Leuprolin, Decapeptyl, Buserelin. Once you give it to the patient, you make the patient menopausic for 3 months. So what happens? Menopausic, no menstruation. Menopausic, it's dry season. Mid-dry, no hormones.
No pregnancy.
No pregnancy.
Yes, in that
for 3
meantime,
months. You can
can't
give
get
it for 3
pregnant.
to 6 months. So this, we're talking now of the medical treatment.
Yeah, medical treatment for endometriosis.
You're eager on surgical. Well, they did find out that this was in Denver way back 2007 in one of the convention. If you treat purely medical, endometriosis comes back at least 10% in 1 year, or maybe in 2 to 3 years. If you do surgical and you do medical, it comes back more or less 3 to 5 years. So if it comes back in 3 to 5 years, you have that window of opportunity.
To get pregnant.
You have to be quick. You have to be aggressive. Because when it comes back, Doctora, she's an OBGYN like me and we're all exposed to this, it becomes more severe.
Endometriosis.
Yeah, it's
oh.
parang, you know, in
Parang
Filipino,
nagre-react, no?
parang,
Nagsuspread.
parang
Negative.
uling, patayin mo yung uling,
Lalong,
lalong nagbabaga,
babaga.
umaapoy.
Ganun pala yung endometriosis.
That's why you see yung mga, di ba? That is endometriosis. It's a lifetime disease. Till menopause.
So women who have already reached menopause are no longer at risk for endometriosis.
Well, depends, no?
It
Right?
depends.
I
But
agree with her because
likely.
if you have endometriosis and you're 40 years old and above, there are literature now coming out issued by the American College of OBGYN, and my colleagues have read this or what. 40 years old and above, and there are endometriomas or endometriotic cysts, you have to investigate well no matter what size because the incidence of adenocarcinoma of the ovary is higher.
And they don't disappear, right? Not like the ordinary myoma in the uterus. Sometimes without the estrogen, they subside or they become little. But this
Correct.
one, they're practically, the moment you have a cyst, they can really grow. It will not totally disappear, right?
Yes.
Without surgery.
Well, because you know there's a panacea of tofu tablets, soybean,
Treatment.
taho, tokwa. These are phytoestrogens.
Phytoestrogen.
So you might be menopausic, but you have lots of phytoestrogens.
In your diet, maybe, or whatever.
Your diet is full of farmed fish, red meat, and they have antibiotics. They have hormones. So what happens? They become alive again. Or they continue, as Dr. said, to be status quo, or at least they're active. And we don't want that. Oh, Doctor, you did mention that there is something like a myoma. You know, the endometrial lining, like our skin, it has layers. The flooring of the skin of the endometrium, the basal layer, as we get, as the women, that except me. So it's only in women, they have the uterus. The basal membrane layer gets destroyed, or it goes inside the muscle layer of the uterus. So every time you menstruate, then you have some sort of a myoma, but you call it adenomyoma.
So it's a mass, really.
It's a mass,
present
and
inside.
it's there, and it's difficult. I've seen, or my colleagues also have seen that you can see it at 20 years old, 30 years old,
As
and
young as
more
20 years old.
it becomes more difficult for everybody.
Pero delikado po ba yun, yung myoma na yun na
Depends
sinasabi
din.
ni Doc?
Well,
Is that
the adenomyoma, the problem is, we said before, it causes infertility.
fertility?
How do you treat adenomyoma?
Oo nga. How do you
So, there was a Japanese Ochida, something like that. I don't remember, but what you do is you excise as much as possible, but you cannot excise it because the endometrium has invaded the muscle layer. Adenomyosis. Read it on the internet. Treatment hysterectomy, but there is hope. You can remove as much as possible, operate on the uterus, and do a flap method, like cover it like that. The incidence of rupture is high and everything, but, well, in the series of Chida from Japan, out of 12 patients of his, 4 got pregnant. Some got miscarriage, 4 delivered.
I know of a particular colleague, a pediatrician, who had several myomas, and she didn't want it removed. And she did get pregnant, had 2 children pa nga, but of course by cesarean section. No
She
way.
decided
Is this
against
possible? Or is it safe for the majority, or you should individualize, or what?
Oh, are we talking of adenomyosis
Yes,
or
adeno.
myoma?
Adeno, you have already the mass there. A myoma, whatever.
Well, as I said before, if it is endometriosis, adenomyosis or
Myoma,
endometriosis
they're a little bit-
interna, which has developed into a myoma, sometimes I myself have seen about patients of mine who get pregnant even with adenomyosis. So
okay.
who are we to predict? But in some cases, severe cases, you get pregnancy. Mild cases or microscopic endometriosis, there's no pregnancy. You know,
Wow,
everything is,
as you said, Doc, it's truly a strange disease.
it's a very strange disease condition of women.
Okay, Doctor, we will return after a short break. Please stay tuned on Medical Dilemma. Thank you.
comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?